Hello, I'm Dr. Saroja, specialist in physical medicine and rehabilitation at Akkineni Hospitals. Wishing you good health. Today, we'll review some important points. Please stay engaged and take notes.
All right, let's dive right into this explainer and fundamentally shift how we think about physical recovery and physiotherapy. Today, we're drawing directly from Akkineni Hospital's evidence-based guidelines to essentially tear down some walls. We all have these built-in assumptions about how our bodies heal, how we should manage injuries, and what physical therapy actually entails. But what if the very things you firmly believe are helping you are actually holding your recovery back? Today, we are going to separate the real science of human physiology from those stubborn, outdated narratives that dictate how we treat our bodies. We absolutely have to start right here, with probably the most famous, deeply ingrained cultural saying in the entire world of fitness and recovery: no pain, no gain. I mean, you hear it in locker rooms, you hear it from trainers, and let's be honest, you probably say it to yourself when you're pushing through a brutal workout or trying to rehab a tweaked knee. We have been completely conditioned to believe that suffering is just the essential currency we have to pay for physical progress. But think about this for a second. What if the oldest rule in fitness is actually keeping you injured? If we apply that brute force logic to a body that's actively trying to heal, we aren't facilitating recovery. We are literally just adding fuel to the fire. Pushing damaged tissue past its breaking point just creates more inflammation. It's time we dismantle this idea entirely, because in the context of rehab, chasing pain is just a fundamentally flawed strategy.
To understand why, we really need to redefine what pain actually is. Think of it like your body's alarm system. It's an indicator of tissue damage or dysfunction. It's a protective warning signal, not the fire itself. And it is definitely not a requirement for recovery. Now, a little therapeutic discomfort like a deep stretch or muscle fatigue during specific exercises, that is totally acceptable and expected. But persistent, sharp, severe pain, that is your body's dashboard warning light flashing red, telling you something is wrong. The whole goal of modern physiotherapy is to restore your function while actively minimizing that alarm. A pain-free recovery isn't just possible, it's honestly the preferable path.
Look, it is incredibly tempting to just make the couch your best friend after an injury and rely on total, complete rest to heal. But locking yourself down actually worsens your outcomes. It causes rapid deconditioning and stiffness. Instead, progressive activity is what genuinely accelerates recovery. When you move under professional guidance, you're actively pumping synovial fluid to lubricate your joints. You're increasing blood flow to mobilize those healing tissues. And you're signaling to your cells how to rebuild properly. You can't just freeze your body in place and expect it to thaw out perfectly healed.
And hey, speaking of pain, it's so easy to assume that a sharp ache automatically equals permanent catastrophic damage. But in reality, it rarely does. Acute pain typically resolves in just a matter of weeks, and many highly painful conditions heal completely. Often, your nervous system remains hypersensitive long after the actual tissue has already repaired itself. So even if pain persists, a professional evaluation is the only true way to determine what's actually going on under the surface. Do not let the mere presence of an ache convince you that you're broken beyond repair.
Which brings us to a really crucial realization about the rehabilitation process. Movement is a science. It is not a brute force effort. You can't just throw unstructured, chaotic energy at an injury and hope it fixes itself. Physiotherapy exercises might look incredibly simple from the outside. A slight leg lift, a controlled stretch, but small variations in joint angle and muscle activation massively impact their effectiveness. Proper technique, guided by a deep understanding of biomechanics, is exactly what turns a simple motion into a highly targeted healing intervention.
And that leads us to a crucial tipping point. More exercise is not always better. Going overboard just invites overuse injuries and massive setbacks because you're breaking down tissue way faster than your body can rebuild it. The real magic happens when progressive, appropriate exercise is perfectly balanced with dedicated recovery. Following your symptoms and respecting your body's physical tolerance is literally the only way to achieve long-term success. Think of it like this. You have to dose your exercise with the exact same precision that you would dose a prescription medicine.
You might also think you need some million-dollar biomechanics lab or super complicated, fancy equipment to rehab properly. You absolutely don't. Body weight, resistance bands, and simple tools are incredibly effective. Your nervous system and your muscles, they don't know the difference between a high-tech machine and a $5 resistance band. They only understand the tension and the load being applied to them. Professional knowledge, proper programming, and your own correct technique matter infinitely more than whatever machinery happens to be in the room. All right, let's shift gears a bit to something almost everyone stresses over: Posture. We've all been yelled at to stand up straight, pin those shoulders back, right? But holding a rigid, so-called perfect posture is a complete myth. In fact, locking your body into a stiff, upright position actually restricts blood flow and creates totally unnecessary muscular tension. So what's actually healthy? Dynamic movement, postural variation, and relaxation. Honestly, your best posture is your next posture. Being comfortable, balanced, and having the flexibility to move fluidly is far more vital to your spine health than rigid correctness. Similarly, we really need to rethink our warm-ups. We've all been taught that a quick stretch before a run or a lift is like this ultimate force field against injury. But while improving flexibility is great, a truly protective routine requires so much more. You need strength to stabilize your joints, you need balance, proper technique, and most importantly, load management. Flexibility alone just doesn't prepare your tissues to absorb heavy forces. A dynamic warm-up combined with a comprehensive strengthening program is way more protective than just trying to touch your toes for 30 seconds.
Let's look at how this builds over time, because healing is never a single event. It's a phased journey. Weeks 1 and 2 are all about acute pain relief and managing that initial inflammatory response. Then, as you move into weeks 3 through 6, actual cellular tissue healing takes over. After that, weeks 7 to 12 are dedicated to proprioception, which is just your body's awareness of where it is in space, alongside rebuilding all that lost strength. Finally, months 3 and beyond are about a true return to high-level function. Now, these are averages, but they show that genuine recovery is a biological timeline, and it relies heavily on your active participation at every single stage.
Because it's a phased journey, stopping the exact second your pain disappears is a massively dangerous trap. People abandon their program all the time when they feel, quote, fine, but pain relief is literally just step 1. Underlying dysfunction, muscle imbalances, and compensatory movement patterns often linger right beneath the surface. Your strength, muscular endurance, and movement quality still need crucial development. If you skip those final phases, you're leaving your body incredibly vulnerable, and you run a huge risk of ending up right back where you started.
Let's also clear the air on a deeply held societal belief about age. There is this pervasive idea out there that getting older means you have to be entirely gentle, frail, and delicate with your body. But age absolutely does not preclude challenging, intensive exercise. In fact, older adults fundamentally benefit from progressive resistance training to combat muscle loss, cardiovascular activity for their heart, and targeted flexibility work. With a thorough professional assessment, challenging exercise isn't just safe for older adults, it's highly effective and entirely crucial for keeping your long-term independence.
We also have got to stop accepting this fatalistic idea that age-related pain is just some inevitable burden you have to carry. Yes, our bodies naturally change over time, sure, but maintaining activity, building strength, and preserving flexibility drastically reduces age-related dysfunction. A lot of the time, what we quickly blame on old age is actually just the compounding effect of disuse over decades. Simply throwing your hands up and accepting daily pain actively prevents you from seeking out the precise physiotherapy treatments that could dramatically improve your quality of life right now.
And that fatalistic approach really pushes people to extremes, especially when we're talking about back pain. It is so incredibly common to assume that a sore lower back immediately means you need an MRI, injections, or worse, spine surgery. But in reality, conservative physiotherapy is the highly successful first-line treatment for the vast majority of cases. Many times, early imaging actually just shows totally normal asymptomatic aging changes that cause unnecessary panic. Surgery is generally reserved for very specific, severe indications, absolutely not as a default solution.
And on that note, we must deeply validate the complex nature of pain itself. If your pain lacks an obvious physical cause on an X-ray, it is absolutely not all in your head. Your central nervous system can actually become highly sensitized, effectively keeping the alarm bell ringing even when the tissue is totally safe. This means psychological factors like chronic stress, anxiety, or depression can profoundly amplify and worsen physical pain. It is a real physiological process. Comprehensive treatment addresses both the physical mechanics and the nervous system sensitivity without ever invalidating your experience.
So, the bottom line? There is no single magic bullet for recovery. Fixing complex physical problems requires a comprehensive, multimodal approach. The absolute best clinical results come from blending highly targeted therapeutic exercise to build resilience, hands-on manual therapy to improve joint mobility, deep patient education to empower you, and specific treatment modalities to manage symptoms. By combining all of these, you are targeting different neurological and physiological pathways simultaneously for the most robust recovery possible.
And this exact framework is what institutions like Akkineni Hospitals are actively applying. They don't rely on outdated adages. Their entire approach is built on evidence-based practice, deeply prioritizing clear patient education so you genuinely understand the mechanics of your own recovery. They focus on individualized treatments, because let's face it, your physiology and goals are completely unique to you, and they pair that with open communication and collaborative care with other healthcare providers. The whole goal is to treat the whole patient, not just silence a localized symptom.
Which leaves us with one final thought to consider today. Are you just treating the symptom, or are you finally ready to heal the source? We've seen that mindlessly chasing pain relief isn't enough, treating the couch as your primary therapy totally backfires, and accepting unnecessary limitations based on outdated myths only holds you back. Armed with these physiological insights, the choice of how you approach your physical health and your recovery is entirely in your hands. Take an active, informed step today.